Hello, Assalamu alaikum. Very good evening. This is Tanzila Jaman. Would like to invite you to this special weekly show, COVID with Coping with COVID-19. I hope you are managing your time, your health, and your lifestyle, though we are having this really difficult time. This week, our intention, we would like to invite amazing guests, experienced health professionals from different hospital that they can come and share their experience having in hospital as a consultant, as a doctor, highly professionals, their how is going their life, and we want them to give some tips, a very personal experience that you can feel inspiration, also you can have a guide. So today we have amazing guest who is a 46-year in doctor. He's doing amazing profession as a professor in Basildon Medical. At the moment, he is in Basildon University Hospital. So we would like to invite him, and we want to listen how his daily experience. People doesn't want to go to work. People doesn't want to go out, but he is the amazing person among other amazing doctors that have facing this person, this amazing way dealing other people, inspiring other people. So how their life is going on, let's listen to them. So let's introduce our very honorable guest, Professor Rotimi Jaiyesimi. Very good evening.
Good evening,
Welcome,
and
doctor.
thank you for having me on the program.
Thank you to give us your valuable time. I'm really glad that you are a wonderful person. You're waiting for me. We are having nice conversation and now in front of audience. So I would
Thank you.
like to say a massive thank you to join our show because we want to give other audience, the universe, because a lot of people at different places having trouble, having stress, having depressed for this. But you are the one of them amazing frontline doctors that you are serving the COVID people every day in your daily life. So how you manage, how you feel, strength. We would like to listen from you. Would you kindly please share your daily life as a professor having your hospital? Please share your life, please.
Lovely. Thank you for having me, and welcome to our viewers. I do hope you will learn one or two things this evening. I am Professor Rotimi Jaiyesimi. I'm a gynecologist, so essentially I look after women. In addition to that, I look after patient safety, making sure that we keep our patients safe when they come to see us in the hospital. COVID-19 is a new condition that started in December, almost a year now. And when it started, we did not know very much about it. But now we're getting to know about it. In the United Kingdom, we've had the first wave, and many people have contracted it. Many people have died from it, and many people who survived are still suffering from it. At this point, I would like to offer my sympathy or our sympathy to those who lost loved ones, a father, a mother, a sister, an auntie, uh, anybody who's lost any loved one. We offer you our sympathy on behalf of BIM Health Collaborative. Now, COVID-19, like we said, is a new disease, which we didn't know much about, but we are getting to know about it. And because it causes death, it can cause serious illness, we were all very scared about it. When you tuned onto the television, all you saw and heard was about COVID, people in the intensive care unit, people dying. And this brought a lot of fear into our people. Now, one of the things we know for sure is that COVID, the virus, is transmitted from one person to another. So you need that human contact. And we also know that there are measures that we can take to reduce the risk of somebody getting COVID-19. And because it is transmitted by droplets, that is when somebody coughs or sneezes, if they are carrying the virus and they may not know because they have no symptoms, if you are close by to them, within, say, a feet of them, then you may get that virus. And that's why it's important that you keep your social distance, that is 2 feet apart. That is very, very important. If you keep 2 feet away from each other, even people who have the virus and who have no symptoms, it's highly unlikely that you will get the virus from them when they cough or sneeze. Another thing we have realized is the fact that the virus is susceptible. It can be easily destroyed by soap, ordinary soap. And that's why the Public Health Authority and the government have advised us to wash our hands regularly with soap and water. And when you're washing your hands, make sure you wash it properly for 20 seconds. The soap in the water dissolves the virus and kills it off. Now, if you do have hand sanitizers, you can use it, but soap and water is highly effective. So that those are one of the measures that we put in place to reduce the virus. Tanzila said, "How do I cope as a doctor going to work?" One of the
Yes.
things we do before you get into the hospital, you have some security men at every point of entry into the hospital. You are given a mask and you're made to use a hand sanitizer as well or wash your hands. It is compulsory. So you will see us, doctors and nurses, physiotherapists, all of us wearing masks. And that's to prevent transmission between visitors, with patients, or anybody within the hospital. It may surprise you to know that even within our offices, we have now redesigned it and we've made sure that depending on the size of the room, for example, my office, only 3 people are allowed in my office and we must all wear masks. If the room is bigger, it can take maybe 6 people. And again, today we are live streaming on Facebook. We are, and one of the things we now do in the hospital, rather than everybody gather together in one room, we are now using the telemedicine or tele conversation, just like Zoom. So you don't have to leave your office. You sit in your office, you log on, and you can see everybody, and you can all have a meeting. Whereas last year, we'll all travel down, all of us get into a room, and no, but now we're in a new world in that we don't want the virus to come. You will hear about the second surge. Uh, Manchester under lockdown, Lancashire under lockdown, Liverpool. And that's because the virus is coming. And one of the messages I like to point out is the virus is real. Yes, the young or older people are more susceptible to the virus, maybe because the immune system is no longer as effective as it used to be. And that is why, if you are at a certain age, 70 and above, you're told to stay at home to shield. Or if you have comorbidities, you are also told to be careful. And to our young ones, the younger ones, they can have the virus, maybe a little bit of flu. Some of them don't even have temperature or a cough, nothing. But they may be carrying the virus. And this is where we try and appeal to our young children, our young brothers and sisters, that they should please adhere to the basic non pharmaceutical measures: social distancing, wearing a mask, washing your hands, and no large gatherings. Nowadays, when we have weddings, you have like 200, 300, 4 people, attending the wedding. Now the government has cut that down, I think, to about 30 people uh, allowed at weddings. So there we are. And I'm sure Tanzila probably has a question she would like to ask me.
Yeah, thank you so much. I was very attentively listened to you actually, and I try to feel how you're going through this kind of stuff, and you are the witness. So, would you kindly share any of your personal experience? You saw someone was affected, infected, or they had critical situation. Maybe they survived, or any worse situation. Please.
Yes, usually when people have mild symptoms, maybe a little bit of a cough or temperature, we ask them to stay at home and self-isolate. But if they get worse, if their condition gets worse, we ask them to come to the hospital. Now, when they come to the hospital, they are received by the nurses, and we all now, at least you get swabbed just to see whether you're negative or positive. If you are positive, then you are put into the positive, what we call it the red zone, where people with the virus are kept. Not because we want to isolate you, but because we want to reduce the risk of members of staff getting it. Now, things that could be done, you're given oxygen because you need oxygen to get into your lungs. You need oxygen to get into every cell in the body. Now, depending on the severity, we do know that there are certain medication that we use. We call them supportive. They don't cure the disease itself. The body has to fight the virus, but we do use, when it's moderate to severe form, I don't want to go too technical, but we can use steroids. There's an antiviral agent. There's no vaccine for it at the moment. And these are the things we try and do. Try to make sure we support the patient by watching the kidney function, the lung function. Usually you will have an x-ray of the chest to see what the lungs are looking like. But the mainstay of treatment really is to make sure that oxygen is getting to every vital organs. And that could be by just a tube in the nose or a mask on the face so that you can get in as much oxygen as possible. Now, in people who unfortunately are very ill and the lungs are not working properly, those are the ones that go to intensive care unit. And one say thanks to Allah and to God that these numbers are not very high. But in ICU, you get a one-to-one nursing. You get machines that try and support your body to ward off the infection. Your breathing is taken over by the ventilator. But we hope people don't deteriorate to that stage. And this, I must stress the importance of people with comorbidities, diabetes, hypertension, sickle cell disease, people who are immunosuppressed, maybe people on cancer treatment. Please shield. Yes, we all live in households with our families. If you have any of those conditions, let us try and take precautions to ensure that we don't transmit this infection to our elderly parents or grandparents. So the hospital is there, and one of the things we don't want to happen is for the health system to be overstretched. If we have too many sick people, then the hospitals will not be able to cope. And that's why government has put in measure or to put in place the current measures, tier one, tier two, and tier three. That is, two households shouldn't meet. Wales has locked its borders, just like Scotland has done. So it is very important. The hospitals are there, But we as a people can also take preventive measures. A good, healthy diet is important. There are lots of things going on out there. Some are not correct. If you eat a healthy diet, it contains most of it, vitamin D, vitamin C, it contains zinc. So all you have to do is make sure you eat a healthy diet, which most of us or some of us don't do. So a balanced diet is appropriate. And again, when you talk of the virus, um, if you go out and you think you may have come in contact with it, please present for testing. The government is encouraging us to come forward to be tested. And if you're negative, you're negative. If you're positive, you're just told to isolate, to self isolate for 14 days. Thank you.
Thank you so much. It was so amazing information you shared. I really say thank you, and also from all the audience. I can see some amazing comments for you, dear Professor. Fahmida Dilshad, she is a wonderful sister of our community. She's so loving. She said, "Thanks to Professor Rotimi for so many important information." Thank you so much, Sister Fahmida. I really appreciate your valuable comment. Thank you so much. I
Thank you.
can see Hamid also wrote as Assalamu alaikum Tanzila. Apu, you are simply an awesome personality, mashallah. Always feel so proud of you. Oh my gosh. Thank you so much. Lots of love to you, Apu. Thank you and thank you. Afsana Arifin, Assalamu alaikum, alaikum assalam. Thank you for watching, all of you. I'm really, really humble and thankful that you are joined. You are busy, also you are joined with us and appreciated. Thank you so much, Angela Shimur. She's a beautiful sister from Bangladesh. Assalamu alaikum, alaikum assalam Apu. I'm really glad you are here. Thank you so much. Thank you Tahir Apu. আমার অনেক পছন্দ মানুষটা চলে এসেছে. Thank you Tahir Apu, so loving. Thank you very much. Thank you Jubed Bhaiya. Thanks Apu. Thank you so much Bhaiya for joining. Tahira Akhtar, Assalamu alaikum Apu, কেমন আছো? I'm fine, thank you. How are you, Apu? Thank you all of you who have joined and make it lovely comments. I really appreciate. This is not so long, but still you are here and you appreciate it and you comment. I really value you and thank you. At the end of our show, we are very glad that we got a professor from, really it's amazing to hear from valuable information from valuable, honorable person who are serving our country, serving our people, serving our society in this pandemic. People wants to stay home, go away, but they are working. And Professor Rotimi is one of them who is working as a doctor in frontline. They are saving us, not saving them. They are not afraid. They are brave. They are giving their life towards us. So we need to say a massive thank you. Come on, everyone, and say thank you, as Famida Abu is saying, also other people, I think. So we need to say thank you who are working really tremendously for us, who don't care about their life, they care about our life. Okay, so we want to say massive thank you to Professor Rotimi joining with us and sharing valuable information, inspiring you, giving you tips. Also, he explained the measures how we can, as he explained so nicely. So, government is doing some valuable information, ruling you, giving you guidelines. But if we don't listen, we don't follow. I think it's our fault. What can government do if we don't do from ourselves? I think this is our side. We need to responsible because virus is not coming to me. Maybe I am going to. So I need to be safe. Our family need to be made safe. So
Yeah.
thank you so much, Professor Dr. Rotimi. Thank you so much. I really humble. We would like to say thank you and thank you. Have a wonderful good night and good night. I can see somebody wrote something. Fahmida Dilshat Apu, is really amazing to get such a talented person like Professor Rotimi. Lots of thanks from him. Thank you so much,
Thank you
Apu. Thank
for having me.
you.
Thank you to all the audience. Keep safe and keep well. Thank you.
Thank you so much. I want to see you another time with another show because we don't want to far away from our honorable voice professionals. So thank you so much. See you
You're
very soon
welcome.
again another time. Have a good night and
Good night.
thank you. Thank you very
Thank you.
much.
You're welcome.
Thank you.
Thank you.
Thank you so much, whoever joined. I really appreciate Famida Apu, Angelina Shimul, Afsana Apu, Tahira Apu, and also I think some Jubed Bhaiya. So all the sister and brother who joined, I really want to say a massive thank you because it's nice to say thank you with honorable person. They are working in front line. They don't care about their life. They are doctor, they are nurse, they are carer. So we need to say thank you. Also other profession who are serving, despite of this pandemic. So we would like to massive thank you also everyone who are serving in and each way, in every way. Thank you and thank you. Have a good night. Assalamu alaikum. Allah Hafiz.